Okay. There's pain is something I want to touch upon, and pain is quite complicated. It's not very straightforward, and there's two really types of pain. And first type of pain is acute pain, which example can be sort of turning your ankle. If you're out walking and you turn your ankle and there's pain, there's inflammation on the outside of your ankle, because probably you've torn or stretched some ligaments. And what we typically say on that example is through tissue healing, it'll typically take 6 weeks, maybe a couple of weeks longer, maybe 6 to 8 weeks to return to normal, and that pain fits tissue healing. But persistent pain was when you've had pain for what we describe as having for more than 3 months. This is where pain gets a bit complicated, and it's not necessarily linked with tissue problems or tissue damage, and lots of different factors can be related to having persistent pain. Now, these are some different factors. I've stolen on this slide from my old work, but it's a very relevant thing. Sort of lifestyle factors can have a big effect on the perception of pain. If you're sleeping or diet is not quite optimal, those are things which can have an effect. I know definitely that sometimes my knee's a little bit sore, and if I haven't slept well, I feel my knee pain a little bit more. Physical aspects, of course, the conditioning, keeping strong, exercising, maintaining your physical health, and if that's not sort of up to optimal levels, then that can make tissues weaker and might mean we're not exercising as regular. When we have pain, that can get us down. Okay, that's the fourth one, is psychological. If we go back, just go back a slide. Yeah, we'll go to the social one. The social ones, and if we're not if we're in pain, we might be avoiding some of the things that we enjoy, such as visiting our friends and family. And if we're not be able to do that because we're in pain, that can exacerbate pain. But other social factors is we're not coming back from a sort of culture of doing regular exercise. We're not used to doing regular exercise. That can be a reason why pain persists a little bit longer. But also things such as work. If we've got a very physical work, I know a lot of the local population work at the airport, so might be doing a lot of physical work, and if we're not quite conditioned to do that physical work, that can put a little bit of strain on our bodies. But also with airport work, there's a lot of shift work, and there might not be time to exercise, so they can all play a part in sort of persistent pain. Psychological factors, one thing we do know, if we feel a little bit low, that can sort of heighten our pain perception. So if we've got an injury and we feel quite low, that can exacerbate it. But also one thing we're learning is thoughts and beliefs about pain can have a big factor in pain perception. So, for example, one thing with back pain, and we'll touch upon back pain a little bit later on, that lots of thoughts and lots of myths and lots of mixed messages out there in society in terms of, oh, let's not bend forward if you've got back pain. And then if you've been told a lot not to bend forward or not to pick up any heavy weights, and then it's a fact of life, you're going to have to pick up things from the floor, such as a basket of washing. You've just unloaded the washing machine and you have to pick up that. And if you're going to pick up the washing basket and you've already got a fear of bending forward, that can exacerbate the pain. There's other factors as well. The bottom row, such as pathoanatomical, yes, structure can play a part, as we touched upon earlier, but it's not the be all and end all. So that's changes in tissues, genetics, what you're born with, the genes you've got. There's not too many things we can do in regards to that. And the neurophysiological, we touched upon that, about nerves being sensitive. Now, when nerves get sensitive, your body can take a long time to sort of reduce that sensitivity through exercise, but it can happen through sort of exercise, reducing the sensitivity of the nerves.